As the healthcare industry increasingly focuses on elevating the quality of care delivered while reducing costs, healthcare systems are considering how clinical pathways may help them to more effectively diagnose and treat complex diseases like cancer. Clinical pathways are by nature intended to reduce variability in clinical care. The core principle is to select the most effective therapy. When two therapies have similar efficacy, the one with less toxicity is advised. If toxicity and efficacy are comparable, treatment with the lower cost is suggested. While many hospitals are now implementing pathways, not all are reaping the full potential of this tool. To maximize value, health system leaders should think about the following action steps. 1. Driving optimal adherence. And second, negotiating favorable shared saving contracts with payers. A key consideration is whether physicians are fully engaged in adhering to the pathways. While 100% compliance may be impossible, most experts agree that 75 to 80% pathways adherence is attainable and reasonably allows for necessary variances due to patient preference, comorbidities, and other factors. If a hospital's overall compliance rate is below 75%, executives are encouraged to investigate why such variations exist. Another key consideration is the shared saving contracts with payers. Increasingly, payers are willing to negotiate with healthcare systems in a way that leads to mutual savings, especially if these savings are contingent upon better outcomes for enrollees, such as reduced ER visits and rehospitalizations. Some healthcare systems are willing to pass some of their savings to their physicians so that to incentivize them further. Healthcare systems need to carefully consider the variables they can affect when negotiating the milestones with payers and be proactive in leading these discussions. Investing in either developing clinical pathways or participating in already validated pathways should be a critical strategic initiative for all healthcare executives. This will increasingly become important in a value-based care environment where reimbursement is based on value rendered to patients. More information on clinical pathways and case studies on what we just discussed can be found on the Cardinal Health website.